all want the best for the kids in our lives, don't we? And thinking about something as fundamental as heart health, well, that makes you want to know more, to feel prepared.
Exactly. And that's what we're doing today. We're taking a deep dive into the career of Dr. Mohamed Sulaiman, who's a real leader in pediatric cardiology. We've pulled together information from, his professional profiles, medical center websites like Kids Heart, plus mentions in journals and conference notes.
Right. And our mission here is really to pull out the key things about Dr. Sulaiman's work and figure out what it tells us about pediatric cardiology today, especially congenital heart disease.
It can seem like a lot, all this medical info.
Definitely.
Yeah.
But don't worry, we'll guide you through it. We'll keep it clear, focus on what really matters.
Yeah.
Okay, so where do we begin? His early days, maybe.
Good place to start. What really jumps out is just how much training he packed in.
Right.
He got his medical degree from Sana'a University in '95.
Okay.
But then he spent a really significant chunk of time training in the U.S.
Yeah, I saw that. It's like a tour of top institutions. His pediatric residency was at Columbia University, and he even got a WHO award for excellence then. That's pretty impressive.
It really is. Then he got board certified in general pediatrics in 2002.
But he didn't stop there at Columbia, did he? He was a teaching resident, a fellow in pediatric cardiology, even Teacher of the Year in 2004.
Right, and assistant attending physician in the NICU, the Neonatal Intensive Care Unit. Wow. Thinking about it, that early Columbia experience, it gives such a strong base. General pediatrics, yes, but also that critical newborn care.
Which is often when heart issues first show up, right?
Precisely.
And he kept going. Pediatric Cardiology Fellowship at the University of Illinois, Chicago, board certified in that in 2008. Then assistant professor at University of Chicago Medical Center. It shows real dedication.
And then another layer of specialization. He did an advanced cardiac MRI fellowship. That was at Boston Children's Hospital connected with Harvard. Finished that in 2012.
Okay, so cardiac MRI. That's pretty specialized imaging.
Hugely valuable. It gives those super detailed pictures of the heart non-invasively. Crucial for complex congenital problems without using radiation on kids. It shows he's right at the cutting edge of diagnostics.
So for you listening, all this training at these, really prestigious places, it signals serious expertise, not just general medicine, but deep dives into specialized fields. Okay, now that we have that foundation, what exactly are his main areas of expertise?
Well, his focus is really twofold: fetal cardiology and pediatric cardiology.
Fetal cardiology, so dealing with heart issues before birth?
Exactly. Prenatal detection, managing potential problems in unborn babies, a growing field, hugely important for outcomes. He really pushes for that early screening.
That makes so much sense. If you know there's a problem beforehand, the team can be ready right at birth.
It can absolutely change the game.
Yeah.
And then on the pediatric side, he covers the whole spectrum of congenital heart disease. Diagnosing, treating, simple defects, complex ones, whether they're inherited or just developed.
Right. And what else falls under his umbrella?
Well, there's pediatric cardiac intensive care. That's the critical care side for kids with really severe heart conditions. He's a very specialized skill set managing those life-threatening situations.
And you mentioned the imaging earlier.
Yes, advanced cardiac imaging is a big one. Cardiac MRI, cardiac CT scans for those detailed anatomical views.
Okay.
Plus 2D and 3D echocardiography, ultrasound of the heart, and fetal echo too, seeing the baby's heart in the womb. These are powerful diagnostic tools.
It's interesting how these things link up, isn't it? The advanced imaging helps diagnose the congenital defects.
And helps monitor kids in intensive care. Plus, knowing fetal cardiology helps him treat newborns right away. It all connects.
He also deals with heart rhythm issues, stress testing in kids.
Pediatric exercise tests, looking for arrhythmias, irregular heartbeats using Holter monitors. Those wearable ECGs that track the heart over time.
Yeah.
Catches things you might miss in a quick check.
And interestingly, he also works with adults who are born with congenital conditions.
That's right. They often need lifelong specialized care. So his expertise really covers the whole journey, from prenatal right through adulthood for these patients. It's comprehensive.
So he has all this knowledge. How did he put it into practice, especially moving to the UAE?
Right, that's the next chapter. He moved to the UAE in 2012, took up a role as consultant pediatric cardiologist at Tawam Hospital in Al Ain. That was a big move.
Bringing those skills to a new region. And then just a year later, 2013, he co-founds Kids Heart Medical Center. Kids Heart.
Yeah, with branches in Abu Dhabi, Dubai, Al Ain. It's noted as an American-run center, which probably says something about the approach or standards.
And he's CEO and a consultant there, so he's leading it and seeing patients.
Seems like it. He also co-founded the Heart Medical Center in Al Ain.
So Really expanding services in that area.
Definitely suggests a drive to improve access to this kind of specialized care. You wonder what the landscape was like before he arrived.
That's a good point. Our sources don't detail that, but him setting up multiple advanced centers, it certainly implies a major boost in available care. And he kept his academic ties, too. Assistant professor at Columbia since 2014.
Yes, and he'd held similar posts before at Rainbow Babies and Children's in Cleveland and University of Chicago. That ongoing link to major U.S. academic centers is significant.
Keeps him plugged into the latest research, I imagine.
Exactly. And he can bring that cutting-edge knowledge straight into his UAE practice. It's a two-way street, really.
And through Kids Heart, he consults at other big hospitals, too. American Hospital Dubai, Kanad, NMC, Mediclinic.
Right. It shows his expertise is really in demand across the UAE. So his reach is pretty wide, from top U.S. institutions to major UAE hospitals.
Okay, let's talk about recognition. How has the medical world acknowledged his work?
Well, the formal stuff is pretty solid. He's got those American board certifications in both general pediatrics and pediatric cardiology. We know those require tough exams and training.
Definitely. And fellowships, FACC and FAAP.
He's a fellow of the American College of Cardiology, FACC, and a fellow of the American Academy of Pediatrics, FAAP. Those are big deals. Peer recognition of achievement and commitment, plus memberships in the American Medical Association and the American Arab Medical Association. Shows engagement across different medical communities.
But this role as chairman of the scientific committee for the International Pediatric Conference, that seems particularly noteworthy.
It really is. It's a collaboration between Columbia University and Kids Heart, running since 2013. Chairing the scientific side of a conference like that, it puts him right at the center of shaping the conversation, pediatric cardiology, especially in the region.
Bringing experts together, deciding what gets presented.
Exactly, and highlights his dedication to education and pushing the field forward. And, being described as one of the most sought-after pediatric cardiologists in the UAE, that says a lot.
It really does. Bringing that cutting-edge care is vital for families there. Okay, beyond the awards and titles, what's the impact on patients, on families?
This is where you really see the difference he makes. The feedback from patients consistently talks about his compassionate care.
That's so important, isn't it?
Absolutely, especially when parents are worried about their child's heart. They mention his professionalism, his reassuring way. It clearly means a lot.
That calm confidence from a doctor can make all the difference. And it's more than just bedside manner, right? The Kids Heart Centers are known for accurate diagnoses.
Yes, even correcting previous misdiagnoses sometimes. Getting that diagnosis right is just foundational. It changes everything for a child's treatment plan.
You mentioned better outcomes. Any specific examples jumping out from the sources, maybe complex cases or rare conditions?
The sources focus more on the overall pattern rather than specific cases, likely for privacy. But the theme is consistent. Accurate diagnosis leads to good treatment plans. Lots of families report significant health improvements in their kids after getting care at Kids Heart, and they directly credit Dr. Sulaiman and his team.
That real-world impact, that's the bottom line, isn't it?
It really is. It makes all the training and leadership tangible. You hear these stories, and it just drives home how much this skilled, compassionate care matters to families going through immense stress.
It really puts his work into perspective. All that background translates into better lives for kids. Now, what about his work beyond the clinic? Research, education.
He's definitely active there, too. He's involved in expanding medical knowledge and teaching others, professionals, and the public.
How so? Publications.
Yes, he's authored or co-authored research papers in well-regarded journals, like the American Journal of Medical Genetics, the Thoracic and Cardiovascular Surgeon, topics related to congenital heart disease, best practices, that kind of thing.
And speaking engagements.
Frequently. He presents at international conferences, sharing his experience on congenital heart defects, fetal cardiology, the advanced imaging techniques we talked about.
Like that talk at the Pedia Dubai conference on when to refer to pediatric cardiology.
Exactly. That's crucial info for general pediatricians. He's also active in the Kids Heart conferences, moderating panels like one on Kawasaki disease guidelines. It shows he's invested in ongoing professional development in the region.
And he reaches out beyond doctors, too.
Media appearances, public education. There's a Kids Heart Academy video series that looks at case scenarios and best practices. That's a great resource for other professionals, but also gets information out to the public.
Online videos, things like that.
Yeah. And he uses social media, too, apparently, to raise awareness about things like early screening for congenital heart disease.
That's quite proactive, reaching out directly to the public.
It shows a real commitment to public health, beyond just the patients who walk into his clinic. So yeah, through research, conferences, education, he's not just practicing medicine, he's actively contributing to the field's growth.
It's a deep dedication, clearly.
That dual role, clinician and educator, is so valuable. He's using the latest knowledge in his practice, but also helping shape the future of care by sharing what he knows.
Okay, so let's try and wrap this up. If we distill everything down, what are the main takeaways from this look at Dr. Sulaiman's career?
But we've seen someone with incredibly extensive training from top U.S. institutions. He's got this dual specialization in fetal and pediatric cardiology, strong expertise in advanced imaging, and critical care.
And he's clearly become a leader in the UAE, founding medical centers, maintaining those academic links.
Right. And importantly, patient feedback highlights not just his skill, but his compassionate approach, leading to real positive outcomes for kids.
Plus, he contributes beyond the clinic through research, speaking, educating other doctors, and raising public awareness.
Exactly. It's a picture of a highly dedicated expert working in a very complex field.
This deep dive definitely underscores those complexities in pediatric cardiology, but also the commitment of people like Dr. Sulaiman. It's reassuring to know experts like him are focused on children's heart health.
And that brings us to a final thought for you, our listener. We've talked about the advances in fetal and pediatric cardiology, kind of through the lens of Dr. Sulaiman's work. So looking ahead, what future breakthroughs do you think are most likely, or maybe most needed, for finding and treating congenital heart disease early?
Yeah, that's interesting to think about.
Think about where technology is going, where research might lead, and that constant drive to improve patient care. Such a dynamic area, and the potential to help kids and families is just enormous.